You start Zepbound or Ozempic. A few days later, your stomach files a complaint: nausea, fullness, constipation, diarrhea. And one question shows up immediately: how long is this going to last? Most people are not asking whether side effects exist. They are asking whether this is a rough first week, a rough first month, or the beginning of a very bad relationship. This is not medical advice. Consult your doctor. Most common side effects with these medications, nausea, fullness, bloating, diarrhea, constipation, tend to be most noticeable during the first few weeks after starting treatment or after a dose increase. For many people, they improve with time, but not all side effects follow the same schedule, and not every symptom behaves the same way. I'm Dr. Kim. Whether you are on Ozempic, Wegovy, Zepbound, or Mounjaro, the GI side effects tend to follow a similar pattern. Let's break it down. The honest answer is, it depends on which side effect, where you are in the dose schedule, and how your body adapts. The roughest stretch is almost always the beginning. A lot of people feel the most noticeable GI symptoms shortly after starting or moving up to a higher dose. These drugs change appetite, slow stomach emptying, and change how the gut handles food. The body needs time to adjust, and that adjustment does not always happen at the same pace for every symptom. For many people, nausea improves first. It often shows up early, in the first days to weeks, feels dramatic at first, and then settles down. That does not mean it always disappears quickly or that everyone experiences it. But nausea is one of the side effects that tends to improve as the body adapts. Adaptation is not always smooth. Some people improve, then get another wave after the next dose increase. The timeline is sometimes not one straight line, it is more like a staircase. That is why the same drug can feel very different at week 1, week 4, and after the next dose increase. Fullness and bloating can also be strongest early on. In some people, that heavy, overly full feeling eases after a few weeks. In others, it stays noticeable much longer, especially if the dose keeps increasing. If you eat less because your appetite is lower, that may be part of the intended effect. If you feel so full that normal eating becomes miserable, that is different. Diarrhea can be more variable, brief for some, coming and going for others, especially around dose changes. What people often miss is that diarrhea on GLP-1 drugs is rarely the drug acting alone. It usually takes a trigger. The medication slows gastric emptying, which changes how the intestine receives and processes what arrives. When meals are large, rich, or greasy, more than that altered system can handle. The intestine sometimes pushes back hard. Then there is constipation. It can improve, but sometimes hangs around longer, partly because the drug slows things down, and partly because people are eating less and drinking less. Constipation can be a medication effect, a dietary effect, or both. For nausea, meal size matters more than meal content. Large meals on a slowed stomach are a reliable way to feel sick. Smaller portions eaten more slowly give the stomach time to catch up. Eating something light before the nausea window hits tends to work better than waiting until you are already nauseated. For diarrhea, the trigger is often dietary. High-fat meals, very rich foods, or eating faster than the stomach can now handle tend to be the common culprits. A food diary for a few days can sometimes reveal a clear pattern. For constipation, the approach most often overlooked is hydration. People on these medications eat less, which means they are also drinking less, sometimes without realizing it. Fiber without enough water can actually make constipation worse. The sequence matters: water first, then fiber, then movement. These adjustments do not eliminate side effects, but they can meaningfully shorten the adjustment window for a lot of people. Beyond diet, injection timing is also worth paying attention to. Most weekly GLP-1 injections follow the same pattern. Symptoms cluster in the first day or two after the injection, then ease off toward the end of the week. If that pattern holds, the worst days become predictable. Some people choose to inject on a Friday, so the roughest stretch falls over a weekend, a small adjustment that costs nothing to try. Some side effects, however, fall outside the normal adjustment pattern entirely. Severe or persistent vomiting, the kind where keeping fluids down becomes difficult, is not a patience test. Significant abdominal pain, especially pain that radiates to the back, should not be ignored. In some cases, GLP-1 medications have been associated with pancreatitis, which is inflammation of the pancreas. Pain that is severe, persistent, or unusual warrants prompt medical evaluation, not watchful waiting. Gallbladder issues are another area worth knowing about. Rapid weight loss of any cause can increase the risk of gallstones, and some research suggests GLP-1 drugs may have an independent effect on gallbladder motility as well. Symptoms like sharp pain in the upper right abdomen, particularly after eating, are not something to attribute to ordinary GI side effects. If a symptom feels qualitatively different, more severe, more localized, more alarming, it deserves medical attention. Here is the part that surprises most people. Even after the body adjusts, the timeline can reset. With GLP-1 drugs, dose escalation resets the clock. You start low, you adjust. Then the dose goes up. Symptoms may flare again. So when someone asks why side effects are still here after a month, the body is often not dealing with 1 month. It is dealing with repeated increases. Think of it in 3 buckets. Bucket 1, early and temporary. These often improve within days to weeks. Bucket 2, recurring with dose increases. These improve, then return when the dose changes, then improve again. Bucket 3, persistent but manageable. These may continue in milder form as long as the medication continues. One mistake that happens most often in Bucket 2, stopping the medication at exactly the wrong time. Side effects tend to peak around dose increases. That means a lot of people are at their worst right before the body would have started adjusting. Stopping partway through a new dose level means never finding out whether the body would have settled. That is not an argument to push through genuinely severe symptoms. It is an argument for distinguishing between this is hard and this is not working. And that distinction is worth making with a doctor, not alone. So here is the bottom line. At the start, and at each dose increase, side effects tend to be most intense. Practical adjustments, smaller meals, avoiding dietary triggers, more water, and paying attention to injection timing can shorten the adjustment window for most symptoms. And some symptoms, including severe vomiting, significant abdominal pain, or pain radiating to the back, fall outside the normal timeline and deserve prompt medical attention. The timeline is not one straight line, and neither is the adjustment. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.